Welcome back to another episode of ASDA at WesternU's Ethical Issues in Dentistry series, a series where we talk with faculty and students about ethical issues they've faced in the past and how they overcame it. My name is Philip, and I'm pleased to introduce to you Dr. Joseph Flask, who received his DDS at Marquette University School of Dentistry in Milwaukee, Wisconsin. He serves both as a preclinical and clinical education as an assistant professor at Western University, a D2 course director, and a clinical faculty member. Dr. Flask, thank you for joining me today.
Hi, it's good to be here.
So, Dr. Flask, to get us started, can you tell us a little bit about yourself and why you chose to become a dentist?
That's a question that I think I've gotten quite a few times in the past, and I've never had a great answer to it. It's honestly kind of been this field that fell into my lap a little bit. I knew that I always wanted to work with patients. I knew that I liked science. I wanted to do something that worked with my hands a little bit. And when I kind of thought about all the different options I had, dentistry seemed to fit. So I shadowed a couple doctors, and it was the field that I eventually went into.
Yeah. Awesome. Dr. Flask, can you tell us about an ethical issue you've encountered in dentistry, whether in school or in practice, and how you handle that situation?
Sure. Yeah, I think that's a great question because as students, you don't always realize how many ethical issues you can run into in a private office. Um, for me, I had one option that kind of happened more often than I would have liked to see.
Hmm.
I worked in something of a small town, and we had a big corporate dental office nearby. Um, and it was all too common that we would get patients from that office that seemed to have overdiagnosed the
Hmm.
patients. So they were coming to me for a second opinion. Um, One case in particular stands out to me because it was a patient that came in pain. She
Hmm.
was mid-20s, really, really nice. And she wanted a second opinion because she went to see another dentist. And after doing just one filling, she left in pain and had a laundry list of more fillings to go.
Hmm.
So as it was an LOE, I started asking a lot of different questions to try and figure out more information. And it turns out that I knew the old dentist that did that filling. She was actually an old classmate of mine. So it
Oh.
just kind of compounded the potential ethical dilemmas that I was about to face. Um, I took a look in her mouth, and she had a nice resin occlusal on number 19, relatively conservative. I didn't really think anything of it, but that was the tooth that was causing her pain. When I did a general scan of the rest of her mouth, she didn't have any other fillings in her mouth. That was the only one. So we tested the tooth, we took an x-ray, and as soon as I saw the x-ray, I realized that this filling went very deep. It was very
Oh.
close to the nerve. And the testing came back as irreversible pulpitis. So this one filling on this tooth now needed either a root canal or an extraction. And
Hmm.
this is the only filling this girl had ever had. Um, so the patient comes and she starts asking me questions on whether or not I should um, or what I would recommend and how she should proceed. And I told her, I'm going to give you the diagnosis of what I tested. I know this is your first time with me. This is just a limited exam. If you want to return to your other dentist, I don't have any issues with that. I'll tell you exactly what I think you need, and we can go from there. So I did, and she decided to stay with me, and we did the root canal. Everything went well. Did the crown, and ultimately we built up rapport, and she became a comprehensive patient. And through that process, she kind of continually asked me, should I report the previous dentist? Should I, you know, go to the dental examining board? Should I
Hmm.
bring it up? And these are questions I had for myself
Yeah.
because I knew this old dentist. She was an old classmate of mine. Um, Ultimately, my own philosophy is I don't know what that tooth started with. I don't
Right.
know what it looked like initially. So I do want to give my old classmate the benefit of the doubt. It was a little suspicious that there was no other cavities in the mouth, even though there were a lot planned. And it was suspicious that the old dentist didn't give her any warning that, you might have some sensitivity from how deep this cavity went. So there are a few questions in my own mind about how this treatment was given. And, if ethical decisions were easy, it wouldn't be a problem. But this is one that obviously, this is years later, I still think about it. And I don't think I would have done anything differently. I treated the patient the way I would have wanted to be treated, and gave her all the information I could and went from there. She didn't end up doing anything with the old dentist. It was one of those situations where she just decided to move on, and I was honestly glad about that. I don't think it would be worth it to try and pursue it. And from there, like I said, we did comprehensive care, and she stayed with me the rest of the time I was in private practice. So, it was a good situation in the end, but difficult up front. It's hard to meet patients coming from that setting. They're in pain because of a previous dentist. You don't want to be in that situation.
Right. Yeah. It's a tough situation. We just took the ethics class at WesternU, and we had a similar situation come up where, the dentist, I think, was over-treating or over-treatment planning. They came to you saying, I'm in pain, but I used to not be in pain. What do I do? And I think it's just the far too common situation that many students might face in the future, or dentists, I guess, will face in the future. Thanks for sharing that story. And lastly, I guess the last question I have is, what advice would you give to dental students about handling ethical issues in dentistry?
Sure. And this actually ties into that story a little bit, I think. It's the same advice that another dentist gave me a long time ago. Don't worry about the money. I totally understand the amount of debt students get into, having paid off mine and all that. The money will come. You will make plenty, and you will be able to have a very comfortable, happy life. You don't need to overdiagnose or do ridiculously expensive treatment to promote your own wealth. If you do ethical, good treatment, you can still have a great living. So do, that would be my advice.
Well, thank you, Dr. Flask, for sharing your amazing stories. Thank you all for watching this episode of Ethical Issues in Dentistry. Stay tuned for the next series.